At CareHub, our dedication lies in aiding the uninsured individuals who are facing medical needs. This underserved community faces challenges financially and often needs guidance to navigate the healthcare system. By providing resources and assistance, we are addressing the gap in equitable healthcare access and promoting the well-being of all communities, regardless of insurance status. Major contributions to the unfortunate percentage of the uninsured population include economic instability, job losses, and just not being eligible. According to a certain study, 64.2% of uninsured non-elderly adults said that they were uninsured because coverage is just not affordable for them. In the U.S., prevalent chronic conditions like cancer and arthritis demand consistent medical attention, which often poses significant financial burdens. Individuals who are insured can often struggle to afford this form of extensive care. So if you are uninsured, this becomes even more daunting due to the prohibitive costs and the disparities in healthcare access. In the U.S., prevalent chronic conditions like cancer and arthritis demand consistent medical attention, which often poses significant financial burdens. Individuals who are insured can often struggle to afford this form of extensive care. So if you are uninsured, this becomes even more daunting due to the prohibitive costs and the disparities in healthcare access.
While diseases may manifest differently across diverse populations, they do not discriminate based on any one demographic. Understanding the universal vulnerability underscores the importance of equitable healthcare access and comprehensive research to combat diseases effectively and ensure the well-being of all members of society. However, analyzing demographics for the uninsured population is still crucial. Factors such as population size, health center and hospital availability, uninsured population percentage, and the proportion of low-income families vary across states. This data provides insights into healthcare accessibility gaps, guiding policymakers in implementing targeted interventions. Examining a combination of statistics is vital for understanding healthcare disparities between states. For instance, Massachusetts' low uninsured rate of 2.8% contrasts starkly with Texas's 19.4%, despite Texas having a better low-income percentage. Wide variations exist in uninsured percentages across different counties. For instance, while the lowest county uninsured rate in Texas stands at 9.85%, the highest soars to a staggering 32.58%. Analyzing such differences within states provides insights into localized healthcare access challenges and informs targeted interventions to address disparities effectively.
Recent studies by the U.S. Census Bureau reveal alarming figures. A staggering 26 million Americans lack health insurance. Disproportionately affected are Hispanic Americans with an uninsured rate of 16.8% and Black Americans at 8.7%. These statistics underscore the urgent need for equitable healthcare policies and interventions to ensure universal access to essential medical services for all segments of society. Additionally, the 2022 American Community Survey analyzed by CareHub highlights a significant gap in uninsured rates between non-citizens and citizens. Recent immigrants residing in the U.S. for less than 5 years faced a 30.3% insured rate, while those living in the U.S. for over 5 years had a rate of 33.1%. In recent projections from the Centers for Medicare and Medicaid Services indicate a significant escalation in national health expenditures, expected to surge from $4.4 trillion in 2022 to $7.2 trillion in 2031. Healthcare spending per person is set to rise from $13.5 thousand to $20.5 thousand. By 2031, healthcare spending is forecasted to constitute 1/5 of the economy, highlighting the pressing need for sustainable healthcare reform. With 7.7% of the population uninsured, the U.S. stands alone among high-income countries in lacking universal healthcare coverage. According to the Organization for Economic Cooperation and Development, despite exorbitant healthcare spending, both per capita and as a share of GDP, the absence of universal coverage exacerbates the uninsured population.
There are several ways we can improve uninsured people's access to healthcare, such as exploring available government assistance programs, seeking out community health centers, and researching affordable insurance options. Additionally, establishing preventive care habits, such as regular checkups and screenings, can help mitigate health risks. Awareness of nearby hospitals can also significantly impact the uninsured population rates. An understanding of available healthcare resources greatly enables people to seek preemptive health assistance, reducing the likelihood of untreated conditions and emergency room visits. Familiarity with local organizations such as HRSA's healthcare programs can significantly support efforts to advance healthcare access. These centers, often supported by government benefits, cater to individuals with government insurances like Medicaid and Medicare. Their sliding scale fees, based on income eligibility, ensures affordability and facilitates access to healthcare services. Finally, Recognizing disparities in uninsured rates is crucial for establishing future equitable healthcare access. Taking proactive steps to allocate and access resources is essential in combating this issue. By tackling these root causes, we can narrow disparity and guarantee that everyone has access to high-quality healthcare.
Hopefully, this presentation has ignited a fire that is ready to be used for good. To help, the first step is always educating yourself and gathering your own opinions on a topic. A great place to start is by researching online and reading organizational websites that surround medical communities and looking at our own very website for valuable resources. We can also aid the uninsured by supporting accessible healthcare initiatives, advocating for policy changes to expand coverage, volunteering at free clinics, donating to organizations providing medical assistance, and promoting awareness about available resources. Empathy, activism, and collaboration are all vital in addressing the healthcare needs of the underserved. Furthermore, there should be a strong interest on enhancing coverage and affordability to reduce the uninsured population, particularly for those excluded from Affordable Care Act financial assistance due to coverage gaps, immigration status, or those deemed eligible for affordable employer coverage. This initiative allows for broadened access and the ability to address barriers to healthcare for marginalized groups. Ultimately, addressing the needs of the underserved insured population requires concerted efforts in policy reform, healthcare access, and community support. By advocating for equitable healthcare systems, fostering awareness, and promoting collaborative solutions, we can strive towards a more inclusive society where everyone has access to essential medical care and support.